Collaboration for Change webinar series. This event is a series of 7 one-hour webinars that NDCPD is hosting as an informational exchange on specific disability topics with presentations from national industry experts while getting to know more about NDCPD skills and services. Today's webinar is titled Identifying How Echoes Can Be Used to Educate Professionals Effectively. To discuss this topic, we are fortunate to have Carrie Glantz and Ty Lee Baker from the University of Wyoming with us. And now we will turn the attention over to our guest speakers.
Great, thanks so much, Michelle. I'm going to pull up our slides, but thank you so much for having us. Ty and I are both very excited to be here and be kicking off this webinar series with you all today. Just to double check, slides, you're seeing slides, not notes? Perfect, great, thanks so much. Great, so just to do some introductions before we get started with the presentation. I'm Carrie Glantz, I'm a Senior Project Coordinator at the Wyoming Institute for Disabilities. We are at the University of Wyoming, and my focus is on our education and families programs. And Ty, I'll let you introduce yourself.
Yeah, hello everyone. I'm Ty Baker. I am a program manager with the Wyoming Institute for Disabilities as well, and I manage our health emphasis programs.
Thanks, Ty. So yeah, we're going to be talking about Project Echo, how we have used it. We'll talk a little bit about the model, how you might be able to use it as well for professional development. But before we get started, just to kind of help Ty and I understand a little bit more of who is on the call, we are going to launch a poll. So that should be up now, but whoops, that is the wrong one, sorry. Back. There we go. So just to see what your maybe experience with Project Echo is, if you don't have any, that's perfectly fine. But have you ever joined an Echo as a participant, as a presenter? Maybe you're already a hub team member or an Echo partner. That means you have signed documentation. Or if you're here just to learn, that's great as well. I see looks like that's probably the majority of folks today, so that's really great. And then if you are affiliated with a University Center of Excellence in Developmental Disabilities or a LEND program, maybe both, maybe neither. Okay. Perfect. Great. Well, it looks like there are several 23% participants have already joined an Echo before, so that's really great. Yeah, the vast majority, almost 80%, are just here to learn, so wonderful. Hopefully we will do a good job of teaching you about the Echo model today. We do have some folks from USEDS, a couple from both, most from neither, so great. I'm going to go ahead and end that poll, but thank you so much for sharing a little bit about who you are today, again, to kind of help us guide through this presentation. So Ty and I mentioned, right, we are at the Wyoming Institute for Disabilities, or WIND, at the University of Wyoming. We were established as the USED in 1994, so we're really excited to be celebrating 30 years of WIND this year. And we are an academic unit, and we are housed within the College of Health Sciences. We are the University for Excellence in Developmental Disabilities, or the USED for Wyoming. So if you are joining and you're not familiar with the USED, there are 67 in the country. Each state and territory has at least one. Some larger states have more, but we are the USED for Wyoming. Our experience, we have been an Echo partner since 2014. So another big milestone, we're celebrating 10 years of our Echo work this year. And then we've also been an Echo Super Hub since 2015. So I'll go through some of these terms, but a Super Hub really is a designation that we have been given to provide trainings, technical assistance, and help support other Echo programs and hubs as they are getting launched. We were also the recipient, we're very proud of the Echo Excellence Inaugural Awardee. There were, I think, 11 this year at an annual or biannual conference in Albuquerque, New Mexico, and we were really excited to celebrate that award this past fall. So what is ECHO? So ECHO, the acronym does stand for Extension of Community Health Outcomes. ECHO's roots are really in healthcare, but we're going to talk about it more as a learning framework and this model and how it has evolved from healthcare model into education, disability supports, lots of various topic areas. So Project ECHO started in 2003 at the University of New Mexico by a doctor who's specializing in hepatitis C. Dr. Sanjeev Arora was the founder of ECHO, and he developed the model after working with patients with hepatitis C. And so one in particular was a 43-year-old woman who had hepatitis C, and she was seeking treatment for the first time after she had received an initial diagnosis 8 years earlier. So when questioned why she delayed the treatment, she said she couldn't afford to take time off work to make the 5-hour trip to Albuquerque. She was also a widow, had 2 children to care for, and she finally sought help when her abdominal pain became too much and began interfering with her ability to work. Unfortunately, she waited too long and passed away 6 months later due to advanced liver cancer from her untreated hepatitis C. So this story was not unique to patients that Dr. Arora was seeing in his Albuquerque clinic. And he was seeing people that were dying of a treatable and curable disease just because they could not access timely treatment. So he first decided to send out his protocol for treating hepatitis C to primary care physicians across the state of New Mexico, but realized that just providing that information wasn't enough. So to master the complexity of treating the disease, providers needed something more. And he was inspired by the way that clinicians learn from medical rounds during residencies and wanted a way to better share his expertise with other providers in New Mexico, especially those in rural areas. So Dr. Arora recruited primary care clinicians throughout the state to create a virtual community of practice or a space where doctors could learn from experts and learn from each other. They could discuss real life case examples that offered insight into these unique patients and systems. So that was the kind of the first Project ECHO program and really became a success story in New Mexico. So since that time, the ECHO model has evolved into a learning framework that applies across disciplines for sustainable and profound change. Local communities are empowered through the communities of practice and the expert knowledge where they live. ECHO does have a global reach. Just to give an idea, today there are over 1,100 ECHO hubs or organizations across 68 countries who are delivering professional development through the ECHO model. ECHO has reached over 4 million total attendees in 194 countries. So just to go through a couple of terms as I get started here and highlight, just so you're kind of familiar with some of the terminology, but Project ECHO refers to the entire movement of ECHO. The ECHO Institute, that is the Project ECHO headquarters located at the University of New Mexico in Albuquerque. Meta ECHO is the entire community of ECHO partners. An ECHO Hub, I'll talk a lot about that in a little bit, but those are sites or organizations that are facilitating ECHO programs. I mentioned that we are an ECHO Super Hub, so those are partners who have been approved by Project ECHO to certify new ECHO partners and train them. I think globally there are about 35 Super Hubs now across the world. ECHO partners are organizations that have signed partnership documents and are eligible to run ECHO programs. And then programs refer to the series, right? Or we sometimes refer to them as networks, but these series of sessions based on the ECHO model. Our hub team is a group of subject matter experts that serve as peer models and provide information on best practices. And then our participants are the attendees who are joining ECHO sessions. So just a little bit about how ECHO really is different from either a traditional webinar or maybe telemedicine. Right, so ECHO, we really want to focus on bi-directional communication between subject matter experts and participants. Whereas often in a webinar, it's this monodirectional communication from those subject matter experts to those participants, right? Sometimes we refer to that as get and sit, right? You hop on, you join, you get the information, and then you log off. ECHO, really, we want this communication to be both ways, right? We want participants to have an active voice as well in the community and provide their perspective and expertise as well. ECHO really focuses on education dissemination, and we're really, hoping to create capacity building rather than just individual treatment that you might see in telemedicine. We're also generalizing variety of situations that may apply to more participants rather than focusing on one single individual being served. We also de-identify case information, which allows providers to discuss cases collaboratively. We do not share private medical information or release any of that information that you might do in traditional telemedicine. And then we're allowing local service providers to take on more complex cases and deepen their skills, expanding their knowledge of emerging, innovative, and research-based practices in local underserved areas where training may be limited. So there are four core components to the ECHO model. The first is using technology to leverage scarce resources. So ECHO is delivered virtually over teleconferencing technology like Zoom, which allows accessibility of trainings, also capitalizes on potential cost savings associated with online delivery of professional development and decreases the cost of things like travel and conference fees. Online learning management systems. We also use one here with our ECHO work to share resources and then session recordings. Right, this is much more familiar to folks, especially over the last several years, but I think right back in 2003, this was a little bit more of a novel idea at that time. Sharing best practices to reduce disparities. So ECHO sessions provide high incidence and timely topics while focusing on research and evidence-based content. Hub teams of each network are made up of multidisciplinary teams, and participants have access to those teams and their expert advice. We also apply case-based learning. So this is really the heart of the ECHO model, and I think what really sets ECHO apart from traditional professional development and webinars is really this case-based learning piece. So participants have the opportunity to present their problem of practice to their ECHO network in real time. They receive feedback, recommendations, and resources that can then be implemented into their work. And then evaluation and monitoring outcomes. We evaluate participant learning, and Ty is going to talk about some of our evaluation outcomes in a little bit, but thinking about things like our participants' knowledge change, we look at their intent to use information and their intent to share information with others. So these are the four core components that have to be used in an ECHO program, but there's a lot of flexibility that can be used as well as you're developing your ECHO programs as well to tailor programs that fit your needs. So Project ECHO is this lifelong learning guided practice model that increases workforce capacity to provide application of best practices. Like I mentioned, we're really using this kind of hub and spoke learning framework that creates these knowledge learning loops. Right, we have short didactic presentations or professional development with community-driven problem-based learning sessions. So ECHO facilitators and content experts are our hub team, engage with learners at various community sites for our participants. And we use this, all teach, all learn approach, which allows experts and learners to share their knowledge with each other, and is the modality by which the ECHO model demonopolizes specialty knowledge. Right, so we're also contributing to the multiplier effect. So by participating in ECHO programs, a single specialist, an educator, they can contribute to the development of other experts in their local communities who then go on to apply their newly acquired knowledge to improve the lives of people in their communities. Right, so our networks really are providing this ongoing support for educators, healthcare providers, special service providers, case managers, administrators, other professionals. We also work with families, and in a rural state like Wyoming or frontier state, where specialized knowledge is not always locally available, we're able to break down some of those barriers to specialized knowledge and improve outcomes. Right, so this knowledge learning loop here, this graphic, we have our specialist team at the top, or our hub team. Again, we're creating this all teach, all learn approach with our participants. This one's a little more specific to education, but right, our educators, education professionals, school leadership who are joining these echo sessions, then are able to build their capacity, take the information that they're learning, and be able to apply that with students, communities, and the families they work with. So our participants are also contributing knowledge of their local context, also cultural considerations. And over time, we're developing this community of practice. This learning loop also, our community providers are learning from the specialists or our subject matter experts, but they're also able to learn from each other, especially during that case presentation. And then specialists are also able to learn from their community providers as best practices emerge, right? So they're learning from these local communities, the issues that they're facing, and also their expertise. So the structure of an echo session, again, this is kind of where there's some ability to modify and to adjust as needed by your specific echo program. But here in Wyoming, our echo sessions vary, but most of our sessions are about 75 minutes long. We found that hour and 15 minutes has been really a good time frame for us. Some echo programs may be an hour, some maybe an hour and a half. And most of ours do fall within the academic calendar of August through May. So sessions are held bi-weekly for our echo program, so every other week. And then we average about 6 to 8 sessions each semester. Each echo session includes a didactic session or, again, that professional development. And it's usually around 30 minutes. And it's led by content experts from our hub team or our subject matter experts. And it's left intentionally short to conform to adult learning theory. So we're giving smaller bits of information over longer periods of time. Following the presentation, a participant from the network shares their problem of practice or their case presentation. And so it's really a problem of practice or an issue that they are currently facing. We have a facilitator who leads the entire network in a problem-solving process then that results in a list of recommendations that the case presenter can then use in their practice almost immediately. So as I mentioned, case presentations are really the heart of the ECHO model. They allow participants the opportunity to problem solve with peers and the ECHO hub teams. They also reinforce best practice strategies, and they focus on a current issue or problem of practice. So this allows these case presenters to increase access, quality, and efficiency in their field of work. Again, focusing on that current issue, if we're doing a topic on, let's say, communication for our autism network, if a case presenter has a question around behaviors or something that's not related to our topic for that day, we really want it to be timely, and so we don't have to match the case presentation with the professional development topic. We're really focusing on what are the questions that participant has, so that we can provide them solutions to take back to their work. It also allows other network participants to learn through engagement and through interaction with their peers and the other subject matter experts. And session participants can ask clarifying questions for the case presenter, but then provide their feedback, again, using that all teach, all learn approach. So really the power of ECHO is bringing like-minded people together to problem solve. So if someone is struggling with an issue, they don't have to do that alone, right? There's this team available to lean on and learn from as alternative approaches may be presented for their problem of practice. We also do invite our case presenters back to present again. So they have that opportunity to share maybe what has worked, what they've tried, what they've implemented, and if there's additional questions or strategies that they would like help with moving forward. Okay, these case presentations can also be flexible to meet the needs of the audience that's joining. So some of our healthcare kind of more focused echoes have that traditional clinical case presentation. We do reflective stories, right, that kind of focus more on professional perspectives, experience, your learning journey, and then personal stories, right? This is also incredibly important with our work with individuals with disabilities to address the stigma and the lived experience of accessing systems and resources. I know there's only a few USEDs on the call today, but we do, also want to kind of connect the ECHO model to the core components of a USED, right? So if you are joining from a USED, or a LEND program, right? There's a really this nice overlap of the research piece, the community training, and this interdisciplinary education that really makes the ECHO model fit really well within our work. Also, again, I wasn't sure who is going to be joining the call today, but these are other USEDS and LEND programs that are already using ECHO. So there's 23 across the country, including the North Dakota team. We are up there at the top, along with Alaska Center for Human Development. They are also an ECHO Super Hub, and so we've partnered with them on some training, but a wide variety of topics, topic areas for USEDS that are utilizing the ECHO model. So how have we used it over the last 10 years? So this is a list of topic areas, right? Again, thinking of ECHO as just it's a learning framework, so it can really be applied to any topic area that you may be thinking about for professional development. The ones with asterisks, those are the programs that we're currently running. So Act Early for early intervention. We have an assistive technology network. I will mention that was actually our very first ECHO program that launched in March of 2014. So coming up on 10 years, that one is still running. And that actually was the very first ECHO network in education. So our team translated the ECHO model from healthcare to education in 2014. And assistive technology was that very first ECHO in education network. We also have networks focused on autism for educators, for rural healthcare providers, along with behavior supports. We have networks for early childhood and a network for families focusing on healthcare needs, educational needs of children with special healthcare needs. We have an integrative care, student health, and then our Project Scope, which is supporting children of the opioid epidemic. We will be launching a new cohort this spring, and Ty will talk a little bit more about Project Scope. The map on the right there, that just shows the reach that we've had. So the dark blue square, that's us in Wyoming, right? Most of our participants are from Wyoming, but we have had a wonderful opportunity to do some collaboration and partnerships with other states as well, including Ohio and Virginia, some regional work as well with Utah, Montana, Colorado, Oregon. And so you see some of the reach that we've had nationally as well. And then participants from 8 countries as well. So with that, I'm going to turn it over to Ty. She's going to talk a little bit about Project Scope and then some of our outcomes and evaluation pieces.
Thanks, Carrie. First, before I jump into Project Scope, I wanted to say one of the things, the biggest benefit, not the biggest, but one of the bigger benefits of having an ECHO is that you're building this community of practice and this network of individuals. And I think it's really fitting that we're the first webinar series for this Collaboration for Change that North Dakota, you said, is putting on, because ECHO truly is a venue to be able to build interdisciplinary collaboration, support, and a network to be able to help problem solve, help improve outcomes throughout your entire state. And the other thing is once you start to kind of build this community, it's something that you can tap into beyond just the ECHO networks. If this was an ECHO, we would be strongly encouraging you to turn on your camera so that we could engage with you, even if you were eating your lunch or on a treadmill, getting your steps in, or, having a kid on your lap. We would strongly encourage you to do that, because we want to build that connection and get to know who's on the call a little bit more. It also makes us be a little bit more present to this webinar. So I see a few of you doing that, and I thank you for that. So Wyoming has been doing ECHO for the last 10 years, and we have seen the impact and the value of this model to being able to build capacity, education, and training for professionals throughout the state. And there was an opportunity for us to partner with two other USEDs in Ohio, the Nysonger Center at Ohio State University and Cincinnati Children's Hospital, in order to take this model at a grander scale and to address a nationwide problem. And so with our expertise at Wyoming of the ECHO model and implementing the ECHO model with fidelity and being able to use it as to make an impact on outcomes, and the Nysonger Center and Cincinnati Children's expertise in serving children of the opioid epidemic, specifically neonatal abstinence syndrome, we combined our efforts to create what we call Project SCOPE. So SCOPE standing for Supporting Children of the Opioid Epidemic. We first, before we did the National Training Initiative, we engaged in a pilot project, and that was something just between our two states where we really came together to see, you know, what were the impacts, what were the outcomes, is this something that we could take to a grander scale? And we had positive outcomes. I'm going to talk about that in the next slide. But we then built a national training initiative where we came together and not only trained 14 ECHO partners, or really 14 USEDs and LENS, in how to utilize the ECHO model, but more specifically built a curriculum around supporting children of the opioid epidemic. And we came together. North Dakota was one of those states. So congratulations to North Dakota, who had successfully implemented for 3 years Project SCOPE. Total, we had 14 states that we taught how to do this ECHO model, gave them technical assistance, support, resources in order to build this curriculum. And then they went off into their respective states and implemented this on their own. We had 274 ECHO sessions total, serving 10,473 total participants. Next slide, please. Here are some specifics that we look at. So we evaluate every ECHO session as well as an ECHO network. And an ECHO network can consist of anywhere between like 8 to 12 sessions, or sometimes 6 to 12. It really just depends. But for, as you can see for Project SCOPE, one of the things that we looked at was knowledge level change. So we do a retrospective pre-test where we look at knowledge on a particular subject. So in this case, supporting children in the opioid epidemic, neonatal abstinence syndrome, or NAS. So you can see the blue is knowledge before, and then the green is knowledge after. And you can see that, you know, the blue is more on the left-hand side, and then after we get more more knowledge change on the right-hand side. We also asked, that if they believe they can successfully apply what I've learned in today in my work. And that is one of the biggest things and takeaways from ECHO, is that we're not just providing didactic information on knowledge, we're also providing applicable skills that they are going to turn around and implement into their work. And when we are looking for presenters and when we're putting this ECHO model together, that is something that we consider. Is this presentation going to give knowledge and skills specifically for somebody to be able to implement when they leave this? And as you can see in Project SCOPE, that is true. So, we had strongly agree and agree being the biggest percentage. Next slide. We do have a few other networks. So as we've kind of continued to implement ECHO for the last 10 years and realized that, we've become pretty efficient at implementing this model at a variety of different topics, we continue to collaborate with different states and regions to offer ECHO networks. And one of those is Autism for Rural Healthcare Providers. This is a LEND project, which is a leadership education in neurodevelopmental disabilities. The UR LEND, which is a Utah regional network, is consistent of 5 states, North Dakota being one of them, and Wyoming being one of them. And so we launched in February of 2020, and we continue to offer this ECHO model for healthcare providers in order to provide them best practices, strategies, and support for working with patients with autism spectrum disorder. And so you can see Carrie presented all of the ECHO networks that we, as a USED in Wyoming, specifically implement in our state. But the LEND ECHO as well as the SCOPE ECHO kind of showcase how we've been able to utilize this on a more grander scale at a regional level and a national level. Next slide. Here are 2 particular networks that we use just in Wyoming. Student health is something that we have worked with the Wyoming Department of Education to provide, and Project ECHO for school nurses or allied health professionals. Really, teachers show up, administrators as well, because it takes a village to support our children. And so anyone that is interested in improving health outcomes for our students in Wyoming can join this. Majority is school nurses. But again, one of the cool things that we love and that we evaluate is not only, as you saw in the last outcome slide, that we want them to implement what they're learning, but we also want them to share this information amongst their colleagues and peers. And these 2 objectives that you see are showing that. So yeah, you see 90% saying yes. And then in integrative care, which is integrating mental health in primary care in Wyoming. So they also 96%. All right, so additional outcomes for our student health network. We also look at, are you moderately to extremely, or actually it's a scale, likely to use the knowledge that you gain in the sessions? And are you also confident in implementing the information from the sessions? And you can see in both networks that we have a very high rate of moderately to extremely likely to use the knowledge gained in the session, 92.9% in student health and 100% in integrative care. And then we also have moderately to extremely confident in implementing the information from the session, 87.4% in student health and 71.9%. So these are really impactful as well when we go to our funders, when we go to our collaborators and partners, to be able to say, this model works. It's an evidence-based model. It's been studied in a variety of different ways, but more specifically, here's how it's working in our state, in our region, and in our nation. Next slide. Another one that we really like to look at is from the overall from those that are attending the ECHO session. Has it helped them feel connected to other professionals, and has it expanded their professional, personal, or support network? One of the things that and you can see in student health over 70% and in integrative care 60%. We have a partner, I like to share this story in integrative care, and this is something that I talked about at the beginning when I encourage you all to turn on your cameras. Building that community of practice is huge, and we had a new nurse practitioner in our integrative care, and she was saying, as a new nurse practitioner, I have a group chat, a group text message that I utilize with the individuals that were in my cohort that I graduated with. And if I have a question, or if I'm stuck on something, or if I need a boost of confidence, or if I need to brainstorm, I message that group chat. And as we were talking throughout the network, we had a variety of individuals who were like, man, I wish I had that group chat because I've graduated years ago. I've lost contact with my cohort, or I'm now in rural Wyoming and I don't have people in my corner anymore because, I went to school in a metropolitan area. And I'm looking for that support. I'm looking for that guidance and feeling like I'm not alone. And Echo is able to do that. They get to come on either every other week or sometimes it's weekly. They get to present cases that are, stumping them or problems that they get to brainstorm with their peers that are experiencing the same thing because they're in the same environment as each other. And that has been huge for the networks. It's also another reason why we continue to have these networks every single year, because our participants are finding value in coming and showing up. And that's been huge. And so that's what this metric is really showing us. Next slide, Carrie. We have another one that we really like, and you can kind of see early echo. And Carrie, you want me to go over this, or did you want to jump in?
Yeah, I can hop in on this one.
Okay.
So yeah, I'm part of the Act Early Echo, and this just shows some of the outcomes. But this started in 2020 and 2021 as a partnership with Act Early ambassadors in Wyoming, Virginia, Ohio, and Massachusetts to talk about the impacts of COVID on early intervention services. We also are wrapping up another series this spring. We have one more session that our team in Wyoming is partnering with Ohio, but also just shows a really great opportunity for Echo to do those multi-state collaborations, right? Those organizational collaborations where you can leverage your expertise from each of those organizations. But this network, right, we showed that 86% felt connected to other professionals, 92% are sharing materials with others, and 96% felt like they had a new level, or they had some level of confidence in implementing their learning, right? So Ty talked a lot about the importance, right? They're not just getting the information and learning, but they're really skills that they can take into their work. And then just a couple of comments that were made about that network, right? I feel so informed about these sessions and full of information or full of knowledge, great opportunity for collaboration and shared problem solving. And then someone wrote, I appreciate gaining a better understanding and larger picture of the issues and challenges facing families and professionals through this multi-state conversation and helps have a wider perspective. These are some ECHO program outcomes, right? We talked about, a lot about the data and some of the evaluation pieces, but we've also written some articles. I'll put a link into the chat to our publications page, but just showing some of the impacts if you want to read more about ECHO. We have some related to our work in education, some related to the work in nursing, autism. Our team also did a cost comparison, right? Obviously, we know that online professional development is more cost effective than going to a traditional conference, but our team actually ran some numbers and showed the cost savings of doing Project Echo versus some more traditional in-person professional development. And then, Ty, is there anything else you want to share about Echo before we go into kind of the next steps?
I don't think so. I think we're just really open to questions, comments, experiences that you would all like to share. So either after Carrie is done, or if we want to pause real quick to see if there's any questions, that would be great. And I do believe that Krista said that she would send the slides, but I will put our Echo website in the chat as well once Carrie has finished the rest of the slides.
Perfect. Thanks, Ty. Yeah, we can take a pause here. If you have any questions for us about the Echo model and what that looks like, go ahead and put those into the chat, or I don't know if you want to just go ahead and mute or use the raise hand feature, we can address those. We have some time once I finish up the slides, but I do have just a few slides if you're interested in using the ECHO model, what that process looks like. But I will pause just for a moment to see if we have any questions. Okay, and if not, I know we'll have some time at the end as well, so as you're maybe thinking about those. But I just wanted to share also some next steps and what the replication process looks like. So if you are interested in becoming an ECHO partner or using the ECHO model in your work, these are kind of the next steps for you. So we have getting ready, the ECHO partnership, partner launch training, launch readiness, and then continuous improvement. So getting ready, right? First step, you're all here. You're learning about ECHO. You're learning about the model, maybe thinking about how you may want to implement it into your professional development as a learning framework. Listed there, and I know we'll put in the chat as well, our ECHO website. So you can go look at all the different ECHO programs we have. I did mention, right, that ECHO, they're the 4 core components, but there's some ability to kind of adjust and adapt your programs as needed. Some ECHO programs are closed cohorts. So some, programs, right, you may just have, a set number of participants that you want to join. And then those participants are the only ones who joined through your series. Most of our ECHO programs are open cohorts. So we welcome participants to join at any time. And so if you're interested in joining a session and want to see what one looks like in action, we would welcome you to join our program. I'm not sure about the North Dakota team, but I know they're going to share about their ECHO work as well. So there may be some opportunities there as well. We do have past session materials on our projectecho-wind.com website. Those are all the we do share the past session recording. So if there's any content that you want to go back and watch, record that professional development or didactic presentation. We do not post a recording of the case presentation, right? We really want that as an opportunity for participants to feel comfortable sharing and providing feedback and recommendations. And so we do not share that portion of the recording. And then if you're interested, right, maybe you have your own problem of practice or something that maybe you'd like some feedback from an ECHO community, we would also welcome you to present a case. So after, if you decide that you do want to become an ECHO partner, there is an ECHO statement of collaboration and then terms of use contract. Those are provided. There's no cost to becoming an ECHO partner. This is all through the University of New Mexico, the ECHO Institute. But really, you're just agreeing to follow the ECHO mission and model, use the ECHO name, trademarks, the logos. Right, there's this mutual expectation of sharing, right? Again, we really want to demonopolize information. And so creating this community using iECHO is a database that you have access to as an ECHO partner to store all of your information, participant data, session information. And then there's a program information form that we use to collect that information. So just so we know the global reach, right? I mentioned over 1,100 hubs are using ECHO. All of the 4 million participants have joined. So just providing some data to get an idea of the impact of the ECHO model. Right, becoming an ECHO partner, I think also is really important because you're not only, right, when you join an ECHO program, like Ty mentioned, you're really joining this community, but the same is true as in becoming an ECHO partner. So if you are interested in doing work in early childhood, right, there's dozens of ECHOs in early childhood, and you can reach out to those community partners, learn from them, right, you're not starting over. There's those partners in that community, in the ECHO community, that you can reach out to as well as you're getting ready to launch your program. And then also we shared some examples of some of the partnerships that you can do with ECHO, whether it be other organizations, maybe within your community, within your state, or nationally. There's also a learning management system where all ECHO partners can share their information. So there's lots of different information that you can review from ECHO partners across the world. After you sign documentation, then there is a partner launch training. These are usually 2 days, 2 full days of training to really get a full understanding of using the ECHO model, right? How to create your hub team, what are the roles, the format. We do a more deep dive into case presentations. We go through creating the curriculum, recruiting participants, evaluation, how do you set that up? And then you get an opportunity with your team to do a mock ECHO. So you go through the process with the training partners to see what it's like to facilitate an ECHO program. The ECHO Institute at the University of New Mexico, they do offer monthly trainings. There is no fee for attending their trainings, and those are online. Here in Wyoming as a super hub, we do have a couple of partner launch trainings coming up. So we have one on March 4th and 5th. Just given the timeline, if you're interested in getting those documents and agreements in place, might be a little short on time, but we also have one in August that is scheduled for August 5th and 6th. Again, we're really going through participants as well in these trainings. So the ECHO Institute's trainings are wonderful. They give a really great overview of ECHO and using it. Our trainings are a little more specific and we can tailor them to the groups that are joining. So whether it be education or disability supports or whatever that may look like. We also send out planning sheets in advance and then we work through those together as a team. So we're really helping you, just not giving you the information, training you and sending you on your way, but really helping you to build and think about building your ECHO program over those 2 days. And then we are available for ongoing technical assistance and questions as well. So we really want to be part of the process. We do have a couple of ECHO collaboratives that our team facilitates. So if you are at a USET or LEND program, we have a collaborative for those partners on the 4th Monday of every month. Our colleague Amy Reeser facilitates that. Those are the 4th Monday of the month from 11 to 12 Mountain Time. So any USET or LEND programs who are already using ECHO or maybe are interested in using ECHO can join those. And then I facilitate the ECHO and Education Collaborative, which is the 2nd Monday of every month from 9 to 10 Mountain Time. Again, any ECHO partners interested or already using ECHO for education can join those calls. And it's really an opportunity, again, just to share, collaborate, learn what other ECHO hubs are doing. We do ECHO spotlights often where we, have an ECHO program who will, kind of like we did today, right, share some of the work that they're doing. But we also have that opportunity in the spirit of ECHO to help brainstorm and problem solve together as a group. So maybe it's around case recruitment or creating your curriculum, right? Marketing your ECHOs. So things like that. We have that opportunity to collaborate and talk through as well. So if you're interested in either of those, we would be happy to have you join, even if you're not already implementing ECHO, but if you're just interested in learning more. With that, I think we left some time for questions. So I'm going to go ahead and stop share. Ty put our link into the chat with information about the replication process. And then I will put my email into the chat as well if you have any additional questions and want to reach out.
Thank you so much, Carrie and Ty. We really appreciate it. And I highly recommend checking out some of the excellent work that Wyoming has done. Most of theirs are recorded, and I have watched quite a few of the recordings and had some really good takeaways. So please take a moment to check that out. And I'm going to go ahead and take over and share what we're doing here at NDCPD with our ECHO series. So I'm Krista Opstedal. I am the project director for Project ECHO here at NDCPD. And yeah, we're going to kind of go over what we've done here at our center. So our ECHOs are primarily facilitated through federal and state grants. We also bring our ECHOs through collaborations with other NDCPD projects and for fee through service activities. So if there's a topic that your agency is wanting to learn more about, you can contract with us and we can put together that information and facilitate that within your agency if you're interested. Our ECHO curriculum are tailored around topics that impact people with disabilities. And we do offer social work contact hours for each of our series. And we will offer CMEs for licensed healthcare providers for those series that are applicable for audiences that may need that. We also record each of our sessions and send out additional resources that are discussed during the case presentation. But if you are interested in obtaining the CEUs, we require you to attend the live session. And as mentioned in Carrie and Ty's presentations, our ECHOs are always free to participants as well. So here's kind of a glimpse of some of our concluded series. This includes our Universal Design for Learning ECHO, which was a collaboration with the NDCPD Impact Consortium. This series was designed to support post-secondary faculty in learning about and implementing principles of universal design for learning. This helps meet learning needs of diverse students, increase student engagement, and enhance faculty effectiveness. We launched that one back in the fall and wrapped it up in November of 2023. We also had the Positive Pathways ECHO, which was tailored for K through 12 teachers, paraprofessionals, and school support staff. This series, we covered approaches to understand what drives student behavior and strategies for building personal resilience within our teaching community. The North Dakota Newborn Screening Program, we had collaborated with them to work on a medical home ECHO. The medical home approach focuses on providing high quality primary medical care by building relationships with family, clinical specialists, and community resources. And that's one example of a healthcare series where we did offer CMEs. And finally, our very first ECHO through the University of Wyoming was our Project Scope, which was a national training initiative on emerging knowledge and evidence-based practices in screening, monitoring, and interdisciplinary care for children impacted by neonatal abstinence syndrome, trauma, or related exposure. So those series are concluded, but we always have those kind of on the back burner. So if we find new funding opportunities to launch them again, we will. But also you can access all of the recorded sessions in the meantime. And we currently have 2 ECHOs that are scheduled to launch this spring. We have our Health Equity for Transition Age Youth and our Direct Care Resilience. So our Health Equity for Transition Age Youth, this grant was funded through the North Dakota Department of Health and Human Services, the Special Health Services Unit. We are collaborating with the Wyoming Institute for Disabilities and Family Voices on our hub team. And this series aims to equip healthcare providers with strategies to ensure a successful healthcare transition from pediatric to adult healthcare for children with special healthcare needs and youth with disabilities. We actually tailored this session to have some different key focus areas because when we did our initial literature review, we found that one of the topics or one of the main barriers to healthcare transition was feelings of inadequacy for caring for certain disability conditions among healthcare providers. So we've actually broadened this series to focus on equipping participants with the necessary skills and knowledge to care for patients with disabilities and special healthcare needs. So these focus areas include identifying and addressing ableism in the healthcare setting, kind of using the disability justice approach. And we're also going to provide strategies for successful healthcare transition to give that warm handoff. But even if you're not part of the healthcare community, if you work with anybody with disabilities and you support them to doctor's appointments or med management, this could still be a possible series for you to check out. It is going to launch on Wednesday, March 6th through April 10th, and there's going to be 6 sessions from noon to 1. And I'll include a link to register for any of these sessions at the end of our slides here. We also have our Direct Care Resilience project that's going to launch early spring. This project was funded through the Administration for Community Living, and we also partnered with the Institute on Community Integration at the University of Minnesota. We are about to launch our 3rd and last implementation of this series, and the whole purpose of this project was to enhance direct care organizations' ability to support their employees' mental health. We have a target audience of disability providers, agency or aging organizations such as nursing homes and assisted living facilities. And we really tried to provide strategies to integrate workplace mental health and wellness into organizational's infrastructure and culture. We try to provide resources to help sustain and strengthen the current workforce, and also build DSP resilience skills by increasing awareness of mental health self-care. So as you can kind of see, that this series has 3 focus areas. We usually have 10 to 12 sessions with this one. And part of the sessions are targeted towards the organizational level, so organizational leadership. And we focus those sessions around diversity, equity, and inclusion, and how that can impact mental health in the workplace. We talk about how to understand work as an important social determinant of health, and also provide strategies for creating an inclusive and welcoming culture. Other sessions are geared towards the supervisor level. So how do we prepare supervisors for recognizing the signs and symptoms of compassion fatigue and burnout within their staff? We provide proactive strategies to help mitigate and prevent burnout, and also approaches to build employee engagement. And finally, we have some sessions that are geared towards DSPs, with also recognizing signs of compassion fatigue, burnout, trauma within themselves, and then also providing coping strategies to deal with stress. And while this is all geared towards disability and the direct care industry, it's really just mental health best practices. So even if you're not from this field, I think that everybody can have some good takeaways with this series. And I do recognize some names in our audience as fellow participants in this series. If you have participated, please feel free to check out the last session. We have made some changes since the last time that we presented this, so we would love to have you join us once again. And finally, if you want to register for ECHO, North Dakota or NDCPD's ECHOs, you can visit our website, and you can also scan this QR code and it'll take you to our mailing list. We will just shoot you an email anytime we have a new ECHO about to launch, so that you're familiar, or so you're in the loop, and then you can easily register just from your email. Any questions? Thank you, Susie. She put the website into the chat.
And Krista, if I could launch the last poll.
Yes.
Ready for that. So thank you so much. Yeah, if you have any questions for our team, for the North Dakota team, but I am going to launch a poll while you're maybe thinking of those. Whoops. Relaunch. Okay. So as we are a grant funded organization, right, we always are collecting this data to share with our funders, but just to get a little feedback from you all about today's webinar. But also there's an opportunity if you are interested in joining an upcoming ECHO Partner launch training. And if you want to provide your email, I know Ty and I put our contact information in the chat, and you can always reach out to us. But if you would like for us to send you some additional information, we would be happy to do that as well. And also just a big thank you to the North Dakota team for letting Ty and I come present, and thank you all for joining us. And we're really happy to have kicked off the series. So thanks, everyone.
Well, thank you again, Carrie and Ty, for that great presentation. And as was mentioned, we want to thank everyone for attending NDCPD's Collaboration for Change webinar series. This event is our first of 7 one-hour webinars. If you're able to attend our next webinar, it will be on versatility of applied behavioral analysis, utilizing board-certified behavioral analyst services and consultations to address inappropriate behaviors. And that'll be February 15th at noon Central Standard Time. And if you're interested in partnering with NDCPD to address your training or other service needs, please feel free to check out our fee-for-service website, ndcpd.org/fee-for-service/, or this information will be in the chat, or you can contact Michelle Burney at 800-233-1737. And lastly, we'd appreciate everyone's feedback via an online survey, which is in the chat, and we'll also email it to you after today's event. And for those requiring contact hours, you'll need to complete the survey before receiving your contact hours. So thanks again for attending, and we look forward to seeing you at our next webinar.